you write about the data that the consequences of social isolation and a deteriorating mental health that is associated with these lockdowns. I was particularly struck by the CDC data that you cite that says, let me get this right, that 1 in 4 young adults seriously considered suicide this past June when much of the country was locked down. That's a really stunning number. And these impacts that you talk about in your testimony are really stunning. So can you speak to the challenges that maybe young people in particular, but all Americans face from lockdowns as a mitigation strategy?
I think lockdowns as a mitigation strategy are a failure of policy imagination, and they have had absolutely devastating effects. Humans are not meant to live in isolation, and that's the main focus of the lockdown strategies. Now, I think there are some folks who are at high risk from this disease. As I said, older people, some people with chronic conditions. And so, for instance, 40% of deaths have happened in nursing homes. There, we actually do need to do some sort of isolation, but we have to be careful there as well. There's been a 20% increase in dementia-related deaths in nursing homes, apart from COVID. There's the key failure, I think, is a failure of public health to recognize that there's dangers other than COVID. Heart disease, the psychological distress to young people is devastating. We basically made them feel guilty for doing normal young people things. And as a result, it's had, as you can see, 1 in 4 have seriously considered suicide. That number is absolutely shocking. I mean, I think it should shock the imagination of everyone listening into thinking creatively about policy alternatives to the lockdown. The lockdown should be a very, very last-ditch effort, not the thing that we decide is we should do all the time.
I noticed that now even the World Health Organization, which I have to say is a body in which I place very little trust, and for which, given its conduct in this pandemic, I have very little respect. But nonetheless, even the WHO, I believe, has now said that mass lockdowns as a mitigation strategy they don't recommend them. I mean, quite the contrary, that they think the consequences, some of which you've just outlined from these lockdowns, are devastating.
Yeah, I mean, I think there's an estimate that the UN put out in April, actually, I think, saying that there were 130 million people at risk of starvation as a consequence of the economic damage from the epidemic. I mean, these are lives. 130 million. I mean, that's 2 orders of magnitude more than the number of people who have died from COVID-19. And to not account for that in our policy response, I think, is utterly irresponsible.
Can you talk to me a little bit about some of the other healthcare effects associated with lockdowns and decisions to cancel elective surgeries? I know in my home state of Missouri, many hospitals canceled elective surgeries back in the spring, trying to prepare based on the data at the time for what they thought would be an absolutely massive surge. And even now, as we're seeing cases rising quite significantly across the country, and again, in my home state, a number of hospitals, as a precaution, have curbed elective surgeries and in some cases delay them, which I totally understand. But help us speak to, if you could, the issues that come with the problem of deferred healthcare. And when you have, again, especially in a lockdown situation, when you have many tens of thousands of Americans, millions of Americans, maybe deferring what would otherwise be fairly routine healthcare procedures, healthcare visits. What is the cumulative effect of that over weeks and months as it builds up?
We're going to be paying the toll for that for a very long time. Just to take one example that's, I think, striking to me, mammograms to check for breast cancer declined by, I think, something over 80% nationwide. What's the consequence of that? Many women who would have been diagnosed with earlier stage breast cancers now will come in with late stage breast cancers in next year. We've actually had made a lot of progress in reversing mortality for breast cancer and other cancers in the last decade. That's going to get reversed with 100% certainty as basic preventative measures, colonoscopies, mammography, have gone by the wayside because of COVID. I mean, I think I should be clear, because of the COVID lockdowns. I think that the public health should think about all of health, not simply one disease. Public health is not just about infection control. I think that's been a major mistake that we've made all through this pandemic.